I come from a family of doctors and a family of surgeons. I'm the only orthopedic surgeon in the family, which is really cool. I knew I wanted to help people, wanted to go into medicine. As I was in med school and was experiencing all the fields, orthopedics just kind of really clicked with me. I specialize in orthopedic sports medicine, and I also specialize in orthopedic trauma. I will be taking care of sports disorders of the shoulder, the hip, and the knee. I really enjoy getting the active population back to what they want to do. So whether that's an athlete who tore their ACL in their knee or injured their shoulder with an instability event, or it's the laborer who is a carpenter or a construction worker and their shoulder gets worn down over the years and they have rotator cuff disease. I specialize in hip arthroscopy, so I'll be dealing with hip impingement, especially in your hockey players and skaters and your heavy lifters who tend to get that disease fairly early on in life. My job is preservation of the hip joint. If I wasn't doing orthopedics, I would have been a mechanic. I really enjoyed all the aspects of working on cars. Orthopedics is very similar. The mechanics and all the physics that goes involved with fixing fractures and all the ligaments and tendons throughout the body is very similar. And then you couple that with the ability to work with the active population and the people that just want to get better and they want to get back to their active lifestyle. That really drew it for me. It's something that is very important to me as a former high school athlete around here and college athlete. I grew up in Rhode Island. I grew up in East Greenwich. I went to Bishop Hendrick High School. I did all my education in Rhode Island and then received my medical training in Rhode Island at Brown University and stuck around for my residency. So all of my education, all my training outside of my year of fellowship in Pittsburgh has been in Rhode Island, and I'm very passionate about giving back to the people of Rhode Island. East Greenwich High School is a great high school, and I'm really excited to be starting as the team physician there. What's great about East Greenwich is a lot of their athletes play different sports. They're not single sport athletes, so they're very diverse in what they do. So I'm excited to take care of all of their athletes. I spent the last year taking care of the Pittsburgh Penguins and their minor league teams, as well as the collegiate hockey teams in the Pittsburgh area. So I have spent a lot of time with hockey players. So I'm excited to take care of the Brown men's and women's hockey and kind of continue that excellent care up here. I'm a diehard Boston sports fan. You will probably see me at Patriots games or Celtics games or Red Sox games. I'm also a big Rhode Island sports fan, so you'll see me at all the various universities and all their sports, as well as the Providence Bruins. I'm very committed to being a physician more than just a surgeon.
Comes together like this, you got it.
Understanding your patient, getting to know your patient, rather than just seeing them as a surgical opportunity, is more seeing them as an opportunity to make somebody better. And I took an oath when I graduated med school, and I still take that very seriously as being a physician first. My favorite part about what I do is the after. When you meet a patient and they come into your office and they have a problem in their shoulder or their hip or their knee, you see them at their worst. They're just really struggling to do what they want to do or do what they need to do. And when you see them at that last visit and they're doing really well and they're back to everything they want to do, whether it's with surgery or without surgery, whatever treatment that we decided on together, when that works out for them, that's my favorite part of doing this, because that means that they're successful. They've gotten back to what they want to do and they're happy about it, and I'm happy about it.